My guest today is Dr. Suzanne Haley, a general practitioner from St. Simon's Island, Georgia. Dr. Haley received her dental degree from then called the Medical College of Georgia, now called Augusta University.
Yes.
And then she returned to her hometown of Brunswick, Georgia to start practice, and then moved over to the beautiful St. Simon's Island.
Yes.
Dr. Haley is a sought-after lecturer in the area of sleep dentistry and facial aesthetics, and we're very excited to have her here today. Welcome, Dr. Haley.
Thank you. I'm very glad to be here. Thank you for inviting me.
So, we chatted a little bit, and it sounds like your practice is really not the everyday general practice of dentistry. It's a little different. Did you design it that way, or did it just kind of organically develop?
No, it just happened. I've been in practice 25 years, and when I first started my dental practice, I involved fillings, root canals, extractions, just the general services that dentists offered. But in the past 7 to 10 years, my practice has changed, and now I'm looking at the patient and their overall health. I'm looking beyond their teeth.
Right.
So my whole practice has changed totally.
So a big part of that is sleep dentistry, right? So you're
Yes,
very involved in sleep dentistry. Tell me a little bit about how you got involved in that.
By chance, I was lecturing for a course, and I happened to meet Jeff Weiscarver. And Jeff Weiscarver is the man that invented the software for the Knox T3 home sleep test. He did the bruxism software.
And what is Jeff's background?
He is a sleep tech.
Okay.
He's been involved with sleep forever. He knows everything about sleep. So I started talking to him at a meeting, and he sparked my interest. So after the meeting, I left, and I started looking at any piece of literature I could find on sleep, any course I could take. And I started looking into it, and I thought, this is something that I'd like to do for my patients. I'd like to bring this service into my practice and look at the patient as an overall patient instead of just looking at their teeth.
Okay. And how did you see the need among your patients?
My husband is a pilot, and he was being kicked out of his crash pad that he shares with 6 other pilots because they could not tolerate his loud snoring.
Now that must be like Olympic snoring when 6
Yes.
other guys kick you out.
He's
right?
a loud snorer, and if
Okay.
you looked at my husband, he's in great shape. He runs 8 miles almost every day. He's not your typical person that you would think would snore or have even sleep apnea. So what I did is I made him an EMA from Glidewell, and what that is a dental appliance that pulls the jaw forward so it opens your airway so that you don't snore, so your tongue doesn't fall back there.
So that's really all that's needed in some cases, just reposition the mandible anteriorly?
Mm-hmm. And that's what we did. We put the EMA in, and then it stopped the snoring. But then I started thinking more about it. And so what I did is I had his primary physician order him a sleep test.
Okay. And that's to differentiate somebody that snores from somebody that has obstructive sleep apnea?
Right, because snoring, bruxism, and sleep apnea all are closely related. So I wanted to make sure that this was the right appliance for him. So his physician ordered him a sleep test. When it came back, the diagnosis was that he had mild sleep apnea.
Wow.
Which was surprising to him and to me because he does not fit the criteria.
Now there's some serious health consequences to sleep apnea, correct?
Yes, there can be, especially if it's moderate or severe. And mild, he's like barely mild. But the EMA appliance was able to pull his mandible forward so that he no longer snored, and his airway was completely open, so that he got a good night's sleep, and so did all the other 6 pilots in his crash pad.
Great.
And then later, they all started coming to me because of snoring. So that's how my practice began with sleep.
Right. So you've saved more marriages than
Yes.
a marriage counselor.
Yes, it's called sleep divorce. When husband or wife starts snoring, the bed partner cannot loses like 1 to 2 hours of sleep. It's called sleep divorce because they separate and go in separate rooms, and that's not good for a marriage.
You said that dentists can diagnose snoring and bruxism, but they cannot diagnose obstructive sleep apnea.
No. Mm-mm.
So how do you get that diagnosis?
What we usually do is when we screen a patient and I see that there might be some airway issues involved, they have a large neck, a large tongue, large tonsils. So then what I do is I refer the patient to their sleep physician.
Okay.
Or to their primary physician to maybe evaluate and maybe see if they can have a sleep test. And I have a bruxism, a Gym Pro, that screens patients.
I've seen that device. So that's a screening device that lets you know they wear it at night, and it lets them know if their oxygen saturation
Absolutely, yes.
Right.
And what it is, it's great for all dentists to have because you're not diagnosing sleep apnea, but what you're looking for your patients is your focus is the teeth and bruxism. But also while you're in the mouth, you can look in the airway. You can see all kinds of other health issues that your patient may have. So dentists today need to look a little bit further than the teeth. So when I suspect something, I'll ask the patient to wear the Gym Pro. It's very simple to set up. They take it home, they wear it. It tells us if the patient's snoring, if the patient's bruxing, and that's what we're looking for. But it also tells us if there's desaturations in their oxygen level. And if there are, then we go ahead and refer them out to their primary physician for hopefully a sleep test.
I see. So obviously, as you mentioned, an important part of your practice now. Do you recommend that other dentists get involved in this field as well?
Oh yes, I certainly encourage all dentists to learn dental sleep medicine and screen your patients. Every patient should be screened. It takes an extra 60 seconds to screen your patients. You're doing your patients a favor, their families a favor, and you're increasing your practice because not only are you helping patients, but your productivity is going to increase dramatically.
So how does a dentist get involved in sleep medicine?
The way a dentist needs to get involved in sleep medicine is to educate themselves and your staff. So many dentists make the mistake of only going to a course by themselves and leaving their team at home. Glidewell, in September, Glidewell is going to be offering a sleep course, and it's going to show dentists and their staff how to implement sleep medicine in their dental practice. And we're going to take you step by step. I'll be lecturing, and I'll take you step by step, like cookbook style, and show you how to implement dental sleep medicine and the roles that your team needs to take.
I appreciate you spending some time with us and talking about your passion for sleep dentistry. Thanks,
Well,
Dr.
thank
Haley.
you for having me.
Absolutely.